Well, as weight loss drugs like Ozempic and Wegovy become more popular, concern is growing among obesity medicine specialists that there aren't enough physicians that have the specialized training needed to help patients navigate these drugs. Currently, less than 1% of the United States physician workforce is certified in obesity medicine. And those doctors stress the need for patients taking these weight loss drugs to be properly prescribed and regularly monitored. They worry that without it, patients could be in danger of getting sick. So joining me now is Dr. Celine Gounder. She's the editor-at-large for public health at KFF and a CBS News medical contributor. Thank you for joining us. So my first question to you is, when you go to medical school, how much training do you get when it comes to obesity?
I mean, you would think we get a lot more training, given over 40% of Americans are obese and even more are overweight and obese.
Yeah.
So you would think that this would be a core part of the curriculum. But when you consider the massive amount of information that you have to take in during medical school, it's really an overview. It's not an in-depth curriculum that you get on management of obesity treatment.
Mm-hmm. And these drugs are pretty new drugs, at least when it comes to obesity treatment. So, I'm thinking, you can get this from your regular doctor. You can get it from a specialist. You can get it from a med spa in some cases. You can get it from an online pharmacist. So there are a lot of people who have access to these drugs that are not going to be seeing a specialist on a regular basis. What could go wrong?
Well, there are certain side effects that you want to be monitoring for. So, for example, kidney function, pancreas. Some people develop what's called pancreatitis, where you can have nausea, abdominal pain. And some people have developed gastroparesis, which is where your stomach essentially becomes paralyzed and is not functioning correctly. So there are some significant side effects you want to be on the lookout for. And big picture, insurance companies are not going to be interested in covering these medications if people cycle on and off very quickly because they can't tolerate the side effects. You really need somebody who knows what they're doing to help you manage and be aware of what to do about those side effects.
And what if you are on it successfully, but then you decide you want to get off? Do you need a doctor to help you do that as well?
Well, you do, especially if you want to keep the weight off. So a lot of people put the weight right back on when they stop these medications, and it really does require a shift in terms of your other habits. Very often there's a mental health component in these situations too, what drives you to eat. And so you really do need some help trying to reset your lifestyle and your habits in order to keep the weight off.
So the moral of the story, if your doctor offers you, maybe ask a few more questions as well.
Ask a few more questions and make sure it's part of a holistic plan, that it's not just the medication.
Perfect. Dr. Celine Gounder, thank you very much.